Hello, this is going to be Ernest and Chris with contactless vital measurements. There's been an expanding need to have these before in-person visits at doctors, measurement calculations growing and being wanted. So previous applications would be able to take visual data and capture the beats per minute and display that back to the user. However, if you want to grab a more valuable a piece of information such as the blood pressure, you need a little bit more information. So we were able to integrate into a pre-existing system the ability to ask a user when a face is detected their age and weight and height. So in the pipeline you can have multiple users displayed on screen, and then they would ask them individually for their age, weight, and height during runtime. That bit of code right there took a while to get incorporated properly into that system. So we did a lot of work on presenting a UI element to the user. Did all work to incorporate this calculation that can take average beat per minute and then return us systolic and diastolic blood pressures. That right there is an important piece of measurement that was not easily found in previous works, and pre-works did exist. They would only be able to send you back one user at a time, or maybe they would only be able to use an average of the weight, height, and age, and they wouldn't give you a very accurate number. However, that formula is designed to actually work with direct age, weight, and height values. So we were able to improve our accuracy, not to perfect or acceptable levels. However, that accuracy improvement was enough to put us into a point where our differences, our deltas there, were reasonable, far more reasonable than previous works were. So, Ernest, why don't you go ahead and tell us something about those results?
Yes. And as Chris mentioned, yes, we realized definitely that accuracy based on previous works would start getting worse and worse as you go in away from the average age, weight, and height that they use in their algorithms. And because of that, as you can see in our results, especially on table number 4, you can tell that our blood pressure or our pulse measurement was accurate and on point. And the deviation on our systolic and diastolic pressure is only a few measurements that were a little off. And we believe the reason that those were off is because we plan, if when we get to work on this some more after this paper is submitted, we plan on using a better averaging formula for the pulse, and possibly just not taking the first couple of seconds of when the software recognizes a face and starts collecting the blood pressure, the pulse information. We're thinking about not using that first couple of seconds so we can get a more accurate pulse that will be translated into a more accurate systolic and diastolic pressure, where if we do meet in future works, because this time around we did not meet the standards for medical devices. If we do in the future, once we plan on enacting the changes we're thinking about moving forward, we really see this being used somewhat like a tricorder in the field. It can be used as a an app on the phone that will allow for patients to pre-screen themselves before they go to a medical facility. It will also it has the potential to be used as a handheld device to help reduce the transmission of deadly diseases between medical professionals and patients. And as well, if you're a traveling medical professional that has to go to austere locations, for example, and the islands of Okinawa, to be able to bring all these equipment, you have to go on a small boat. Imagine just having to have a handheld device, and that's a lot less to have to pack to be able to do the same amount of work.
Yeah, so once again, like this code could work on a cell phone, it could work on a personal laptop. Though our testing did use studio lighting, it still was able to that was to reduce potential errors in in our subject test gathering. But I hope you enjoyed. We do have the code public on GitHub, and then it's a current working branch, so you can test that on your own. And was there anything else we want to talk about?
No, that's it. I hope
Eh,
everybody has a great Thanksgiving.
thank you for your time and have a good day.